Hello, and welcome to today's Hospice News webinar, Humanizing Care Through Technology, Empowering Clinicians and Enhancing Patient Connections, sponsored by CareXM. My name is Jim Parker. I'm editor of Hospice News, and I'll be moderating today. And before I introduce our speakers, I'd like to cover a few housekeeping items. First, your lines have been muted for sound quality. Also, this webinar is being recorded and will be sent to participants following the presentation. We also welcome audience questions during the presentation, so please feel free to submit those using the designated box. I'm now pleased to introduce our panel today. With us today is Dean Somerville, Triage Solutions Director for CareXM. Dean's a seasoned professional with more than 20 years in sales and business development. He specializes in enterprise strategy and deal making, process analysis, and innovative leadership. As the Director of Triage Solutions at CareXM, he empowers healthcare organizations through the implementation of new technologies, patient-centric approaches, and cost-saving initiatives. Dean's varied background includes co-founding Optimum Realty and contributing to the creation and sale of Dialogue 5, a business model centered on listening to the voice of the customer, highlighting his dedication to innovative and customer-centric solutions. Also with us is Lori Nelson, Head of Clinical Solutions for CareXM. From a very young age, Lori was drawn to taking care of the sick and wounded and dreamed of becoming a pediatrician. As time went on, her dreams led to a more balanced career choice in nursing. Lori received her BSN from Wichita State University in 2001, and her first job out of nursing school was in a hospital intensive care unit. After 2 years of helping patients survive in the ICU, she made a dramatic career shift to hospice, where she found her love of supporting and empowering those who are making their final journeys in life. Today, Lori is head of clinical solutions at CareXM, where she's worked for 12 years, helping providers to integrate new technologies into their patient care processes, which improve both the patient and caregiver experience, reduce costs, and bring peace of mind to staff. I'm also pleased to introduce Dr. Kathleen Benton, Chief Executive Officer of Hospice Savannah. She's heavily involved in the region through volunteer advisory board roles and professorships at Armstrong State University and the Mercer University Medical School. Dr. Benton has a master's degree in medical ethics and a doctorate in public health. She has authored and reviewed many publications relevant to the topics of palliative care, ethics, hospice, and communication. Her first publication, a children's book entitled Daniel's World, a book about children with disabilities, is the closest to heart. She lives her vocation, passionate about helping families through ethical decision-making processes. She resides in Savannah with her husband Rex and her 3 children, Julia Grace, Jack, and Andrew. Thanks so much to each of you for being here. I really appreciate it. Now I'd like to launch into our presentation. I'll direct this first question to Kathleen first. In what ways have you seen technology redefine patient care within the home health and hospice space, particularly in enhancing both clinical excellence and empathic connections with patients and their families?
Well, I think we have to begin by redefining what is the population today. Who are we treating, and what can we do for them to really change their life? That's really our role as healers. We're looking at a population that is more complex than ever before because people live so long with so many comorbidities. We're also looking at a population that is somewhat crippled by the fact that there's an imbalance in the large aging population, coupled with not so many of the youth coming in as caregivers. So right now, there are more in the age group of 65 plus than any other. And in a few years, there'll be more in the growing 85 plus population. To couple that and make the perfect storm, we just weathered the COVID pandemic. And during the COVID pandemic, we saw the Great Resignation, which came into healthcare. And we saw a lot of caregiver burnout, even for those who stayed. So you have a patient population that is really in a very vulnerable place. They're more disengaged than they used to be. The entire society is more disengaged than they used to be. They're not as interconnected to their community. They're very autonomous and living in their own world, for lack of a better term. And really, what healthcare is supposed to be about, and the original start of healthcare many, many thousands of years ago, was about being human and the human condition. Somehow we have totally sterilized all that in healthcare. So I think even the term you use, what is clinical excellence, we immediately go to infectious disease policies and the best protocol and the best drug of its time, when really at the root of being human, and likewise at the root of being a patient, is being heard. It's in fact their story that weighs most heavily on their disease progression and everything that they are experiencing. So you have caregiver burnout amongst our staff, but you've also got caregiver burnout amongst the sandwich population that's taking care of our patients, those family members that we are also treating in hospice and palliative care. So I think the key at the end of all this in defining the state of our nation is empathy. And how do we re-engage what it means to be a healer, what it means to be a caregiver? And at the root of all that is solid and good communication. You know, it really means setting expectations for the family. It means they need to know what to expect when they go into hospice care. They need to know who they can get in touch with. They need to feel like there's someone that is regularly looking into what is going on with them. And I know my experience, CareXM has done a lot to help this with me, or with my facility and my large patient population. Because truly, even though we come in and we admit a patient, it doesn't mean that through that admission, we have answered all their questions. Much of the time, it's information overload. We haven't had the opportunity to hear the story of that family caregiver or to hear the story of that patient. I tell my staff all the time, if you don't know your patient's name and what defines their happiness, it doesn't matter what their medical record number is and their prognosis. It's important that you know that they used to be a gardener, and the fact that they can't get out in the garden every single day is what is affecting their quality of life. So the ability to touch base with them regularly and check in through new applications in a world where we feel like we can do less because there's so much more to do is so, so important. It's important to regularly set those expectations. It's important to hear that story and regularly reinforce what it is to really meet those patient goals. That is clinical excellence. That is empathy. And that is what I feel like my team is inspired to strive for every day beyond protocols and policies.
Well, thank you so much. Dean, how would you answer that question?
Well, yeah, thanks, Jim. Well, there's a lot of ways to look at that. Really, when you look at technology, it's really you're providing the right tools for your most expensive resources, which are your people, and particularly your high-cost clinicians, and allowing them to leverage technology to really optimize what they do and allow them to do what they love to do. If you put tasks on them that burden them without the ability to really spend time with their patients, which I guess in the past few years, several years, that's been the trend. We really want to unburden what they're doing today, allow them to focus, be very patient centric, focus on that interaction, have that be an intimate moment, and preserve that and reserve that and protect that for the clinicians. They're going to be much happier with what they do. Allows them to work to the really top of their license. We want to try to divert really as much as we can away from what they don't really need to do, particularly like clinical things or non-clinical things and clerical things. We want them to be focused on what they love to do and really spend time on those patients. We also want to leverage technology where it makes sense to get the analytics to help. Everybody wants to do the best job that they can. If they can if they can do better through feedback, through analytics, then they're going to be open to that. They want to provide the best outcomes that they absolutely can. And so technology really allows them to leverage what they do, what they love to do, and to do it better. And so you're going to have a better outcome for not only the patients, family members, caregivers, but your clinicians as well.
Thanks, Dean. And Lori, how have you seen technology redefine patient care?
Well, as Dr. Benton was speaking, I was always taken back by all the processes as a nurse you have to follow, right? And as you go and see hundreds of patients, you're going to see the same processes used, whether it be a disease process as in a disease state or a nursing process. Like, you're doing the same thing all the time. I can do the same thing 100 times in 1 week. However, as a caregiver, I do need to step back and say, hey, this is the first time this is happening to Jim, though. This is Jim's first time going through this process. This is Dean's first time. So I have to take a step back and say, empathy in validating that, hey, I understand that what you're going through is really hard right now. Let me help walk you through this. I don't even need to tell them I've seen this 100 times. I just need to be able to say, hey, this is really hard. This is a journey you're going through that you never thought you'd be in, or, you haven't really planned for, and your family's going through stressful times. Even though I've seen it 100 times, this is their first time, and I need to step back and use that empathy and the focused patient care to walk them through that journey. And what I love about technology is it allows me as a caregiver to let technology do all those processes that I have to do so that I can validate to whomever I'm caring for that, hey, this is your first time. And this is your only time that you may walk down this path, because you don't get to do it over again in hospice, right? It's your only time going through this. So let me help walk you through that in the best way I know how to support you as a caregiver, instead of focusing on, oh, I need to check this box. I need to make sure this is done. I need to do all these things. And so I love that technology can do a lot of that for us, whether it be through an engagement platform, whether it be through, creating efficiencies for me as a caregiver, whether it be through analytics and reporting to have as a business view, step back and say, hey, caregivers, we're lacking in this area. Let's do this better. So technology can do all those things. So as a caregiver, I can go in and really give patient care, focus patient care to families, loved ones who are going through a journey that is not their best day. You're going to see them on their worst day. So help them understand that they have support on their worst days.
Thank you. And I'd like to pivot to talking about the ways providers can overcome systemic challenges. Can each of you share examples of how innovative technology solutions have been employed to tackle systemic issues like staff burnout, resource constraints, and thereby allowing clinicians to prioritize their patient interactions? Lori, would you kick this question off, this discussion off?
Sure. Yeah, there is a statistic out there that you'll see in all sorts of research, news, that tells you a caregiver, a clinician caregiver will spend over 50% of their time, say, documenting, charting, doing administrative tasks. So for every 60 minutes that I have allotted to my patient, there is over half of that I'm doing administrative tasks. Well, as a nurse, I didn't go to school to do administrative tasks, right? I went to care for patients and caregivers. That's my why behind why I chose to become a nurse. So utilizing technology to help some of those administrative tasks happen allows me to work at the top of my license. So I'll give you just a quick example of something that we do day in and day out is, we help our partners take after hours calls. After hours is over 67% of the time you're caring for your patients and caregivers. So a huge chunk of time spent doing triage for nursing triage support. And one of those coordination efforts is understanding who I need to call at whatever time I need to, if I need to send somebody out as a triage nurse, if I need to coordinate with a provider. Well, in order to herd the cats per se to understand who my team after hours is. That's a lot of emails sometimes. That's a lot of Excel spreadsheets. It could be a monthly report, a daily report. Well, if we utilize technology to communicate in real time who's doing what when, I, as a nurse, don't have to look through emails, spreadsheets, update information in all the different ways to find out who I need to communicate with. I can use technology to cut that time down by like 95%. Say, oh, Jim is the on-call provider. I see him logged into our application. This patient needs a new medication order. Done. I'm connecting with Jim. He's given me a new order, patient care focused. So utilizing technology to really eliminate as many manual processes as you can allows for clinicians to once again go back to having that direct patient focused care instead of spending 55% of the time doing administrative tasks. I get to work at the top of my license. The patient gets good focused patient care, and my day feels better as a caregiver because I get to utilize those skills that I have chosen to do as my profession.
Excellent, thank you. And Dean, how would you answer that question?
Yeah, I'm going to actually piggyback a little bit on what Lori said and actually share an example of what we do here at CareXM. First and foremost, when a patient or a family member calls in, we allow them to self-select. Hey, is this an emergent call? Do you need to speak to a nurse? If so, just simply stay on the line. But if it's not, and even in hospice, up to 40% of all calls in the after-hours periods are not even clinical in nature. And so if we don't split those off, then again, as I mentioned previously, we're going to overburden those nurses. We're going to ask them now to take on clinical or clerical duties rather than their clinical duties. And so we try to divert those and send them to a non-clinical resource who's less expensive, by the way, and address those needs. If it is a clinical call and it's clinical in nature and they do need to speak to a clinician, to a nurse right away, then we route that to the first available nurse, and the patient or the family member knows and has a great deal of confidence that if they need to speak to a nurse, they're going to get a nurse very quickly, oftentimes in less than half a minute, right, in 30 seconds or so. So being able to do that and unburden, again, those nurses with those non-clinical tasks really allows them to be much more efficient and better outcomes, especially a better experience for the patients and family members as they're calling in. But it also allows a better, what we call first call resolution. So if it is just a call about, hey, I'm not going to be able to be here for tomorrow's visit, can we reschedule? They can actually talk to somebody who can help them reschedule that and not burden a nurse. So you're really improving the patient experience, reducing that non-clinical requirement from the nurses and directing them to people who can help them, but allowing those nurses more time to address those clinical needs. We've seen great success and great responses from that.
Thanks, Dean. And Kathleen, what would you like to add?
I would take a little bit of a different approach than my two colleagues. Myself, what do I see as the systemic issues in healthcare? What healthcare has, and I'll give you, I have so many specialists involved in a patient's care. And truly, when they come in to speak to a family or a patient about their disease, they tend to speak to their organ, what's going on with the kidney, what are the numbers, what's the whole patient. And I think that systemic problem is only growing as we subspecialize healthcare. It's very questions they really have their team. They're intent, they're frightened, and in their own personal state of psychosis sometimes. To meet for giving good communication and asking the right patient questions. For example, do you understand your disease process? What's going on with your mom? Do you understand why the physician recommended hospice? Our opportunity, systemic nature of things being so disjointed, is to be space and the communication mediums family can engage. As soon as the hospice nurse leaves the house and has admitted a patient, say, do you understand everything? Do you feel like this is the care you need? Maybe, or not at all. These questions prompt the family to ask themselves, the patient to ask themselves, do I understand my care plan? Do I understand? And I think that kind of good communication can reinforce and can be extremely anxiety laden to something that is streamlined and peaceful, a very difficult chapter of a family's life to go that much smoother.
Thank you. Another thing that I'm curious about is how ROI-based staffing models and workflow diagnostics contribute to operational and financial efficiency in healthcare settings. Dean, could you maybe give an example of a successful implementation?
Yeah, Jim, thank you. Sure, certainly multiple examples of how you do that, but one in particular stands out. One of our partner organizations who had some pretty significant growth at the time going on, they knew that they really wanted to leverage the technology to really understand why those calls were coming in and see if they couldn't maybe find ways to better address the training needs and the case management needs. So really, can we do a better job at maybe tying up case management during the day so that we could reduce the burden of the after hours triage nurses? And so what they did is they leveraged the technology, they leveraged the analytics, and what they were able to do was reduce that unscheduled inbound call volume in the after hours period by up to 50%. That, in addition to what I had previously said earlier, in just directing the clinical calls to their clinicians, they were able to really be more responsive to their patients and family members, also to reduce costs, and also obviously provide better outcomes for their patients by really tying up, again, providing the training that's needed for the case managers, engaging in those QAPI projects, having the analytics they need to do so, to really tie up and do an outstanding job in case management. And wherever, again, those case managers were lacking, they were able to provide that feedback to them and help them to improve that case management.
Excellent, thank you. And Kathleen, I wanted to ask you as well, how do these staffing models contribute to greater efficiency?
Well, I think that just like I spoke about before on disjointed care, if you can really look at your staffing model and your tasks and focus on the communication of the tasks and the entire interdisciplinary team being a part of that ROI for team. So, in other words, instead of the matrix just referencing a number of patients to a nurse, what is that? What is the necessity for that care team and that particular patient? It may be that the patient needs more social support. It may be that clinical support should come from a nurse, but also a higher level provider, say a physician or a nurse practitioner. So I think what communication does to change the specific focus on matrix is it allows you to individualize the patient. A patient protocol is not for the entire patient audience uh, collaboratively. One case is one case, one human is one human, and all of the needs are very different. So to simply say that it is fine to have one nurse for 13 patients and no necessity for a physician on that team doesn't bring into acuity, complexity, social support necessity for that patient. But the only way you're really going to understand how to take the matrix and make it efficient to the needs of the patient is to communicate with that patient, understand the story and the need, and then apply the model in that direction instead of just numerically.
Thank you. And Lori, what would you like to add?
I just always have the mantra, try and get the right person with the right patient at the right time for the right situation. It sounds so simple, but it really is getting that the interdisciplinary team approach where you're getting the social worker for social worker needs, you're getting the aide for aide needs, you're getting the nurse for nurse needs, etc. Because when you have the right person doing the right skill, the right time, that patient experience and their journey is better, but it's also more efficient in your staffing models. Nobody's doing somebody else's job, and you have the right skill set for the right need at the right time. So trying to identify some of those models that are appropriate for whatever the need or process is will create those efficiencies. And when your team is doing what they're supposed to be doing, that's where they feel value, and that burnout decreases for sure.
Excellent. Thank you. And just a reminder, audience, if you have questions, please feel free to enter those into the Q&A box on our app here. I'd now like to look at, think about the future of hospice care. So looking ahead, how do you envision the role of communication technology evolving in hospice and palliative care, of course, especially in achieving continuous on-demand patient engagement? Kathleen, would you start?
Absolutely, Jim. So during orientation, much of the time I'll talk with my staff and say, I need you to understand something very important, which changes this from a job to more of a vocation, despite the reason you're here. On any given day in your working world, you may be alongside people who say they are having what they consider the worst day of their life. That is your privilege and that is your responsibility. And with that comes lots of challenges and lots of opportunities. People are really suffering in hospice and palliative care, and that goes far beyond the patient. Much of the time, the patient is in such a mental state or is unconscious that the family is suffering more. And what we're used to in the suffering world, we're all suffering beings, is the ability to nurture one another. We want to fix the problem. And to do that, usually we see that as the ability to get someone better. Parents might fix chicken noodle soup for their kids when they're sick, used to when it comes to taking care of sick people. And then you enter the world of palliative and hospice where the disease is incurable and the prognosis is terminal, and no more chicken noodle soup to fix the situation. So what the family lacks beyond all else is a sense of control. So now we're in a society that is totally disengaged, like I spoke about before, and we're in a very familiar caregiver situation where you're feeling an absolute loss of control to help that loved one. That means every little thing that we do as hospice and palliative providers becomes vital to the day and the peace and the healing of that family and patient. So, as an example, if a certified nursing assistant is running late and that patient is so ready for their bath, they just want to feel better, they want to feel refreshed, or if FedEx is running late, or UPS, or a delivery system, and that medication is vital for the night's meds, those little things become big things for the family who lacks a huge sense of control over the situation. So setting those expectations and being there to communicate. The CNA is running 20 minutes late, but she will absolutely be there. So do not worry about it. Is there anything that we can do in the interim? Being able to communicate, what can I do for you today? Because I know you called in last night and mom was really in a great deal of pain. That has got to have been weird on you. I bet you didn't get any sleep last night. Can I have a volunteer come sit for 3 hours so you can take a nap and know that everything is taken care of? These forms of communication can identify and define the entire experience for the patient and family. That is the future of hospice and palliative. Allowing that kind of control to our families, putting that kind of touch and engagement on a patient and family. We have a massage therapist who works with us. Many nonprofit hospices do. And she has taught me that to give a good massage, you never take your hands off that patient. It's constant contact with the patient to make sure that they're being soothed the entire time. You can feel it when they tense up. The same is true of communication. It's not okay to visit on Wednesday and Friday and then have disjointed communication throughout the week. We have to have hands on the patient the entire time so that the family can seek and find the control that they need, and we can be there when they can't find it.
Excellent. Thank you. And Lori, I'd like to hear your perspective on this, please.
Yeah, if I could just layer in technology to the future of hospice, that's where I really feel like the scenario environment culture that Dr. Benton's creating at her place really can be enhanced by utilizing technology. You know, we always go back to the pandemic of kind of, it was the Band-Aid ripped off of some of the, maybe the old processes, old habits as people, businesses, healthcare. We were so stuck in our ways, and it really just made us do it different. And what we're finding in the healthcare field is technology is no longer a want, it's a need. And communicating with your patients has to be done by technology more now than ever. When you think of your own family, friends, people you are associated with, how many of them still have a landline? It's probably pretty minimal, anybody who still has a landline. So everybody's carrying a cell phone of some kind of smart device, right? It's in their hands, it's available. Then you, next level, look at the demographic of caregivers. I know for me, I am the demographic of caregivers. You know, my dad's 80 plus years old. I'm the caregiver. And what do I use the most? My smartphone. So connecting with our patients and caregivers has to be done by technology. We engage that way every single day in everything that we do in our life. So how do we make that a positive instead of a disconnect? How do we flip that and make that a true engagement with our patients and still have it feel warm and focused in patient care? A text can still be that. I was thinking of an example where, Dr. Benton, you talked about, a patient who loves pets or loves gardening or something like that. How cool is it that I can send a text to my patient? It takes about 15 seconds out of my day to say, hey, I saw this gardening tip on this website, something that really engages, connects, so that when I send my next engagement of, hey, how are you feeling today? Have you had these symptoms? Are you out of these supplies? Are you out of these medications? They are engaged because we have a relationship. So you will have to utilize technology to engage. It's that bridge that's going to connect us, that builds trust, opens doors to people saying, hey, I've had a rough day. These are all of the symptoms I've been having. And now I can say, yes, let's talk about how we can help you through this crisis, how we can help you through, this moment in this journey for you. So the future of hospice is using technology to engage with our patients, whether it's video calls, secure texts, surveys that are asking for, what are your needs, so that when I show up, I'm prepared. I'd love to be able to send a text and say, hey, I'm coming on Tuesday, tomorrow. Are you out of any supplies? Are you out of any medications? Is there something I can do before I get there to make sure that my time physically in your home is focused on you and your care? So utilizing technology to engage with our patients is a need. It's no longer a want. And that is the future of hospice, is the future of taking care of our patients and connecting with them and creating a space where I can truly build a relationship that will help them through this hard phase.
Thank you. And Dean, what's your perspective on what the future looks like?
Well, Jim, as people know from my background, I am super passionate about the experience. I started, again, over 20 years ago, started a customer or consumer experience feedback company. What is that experience like? A decade ago, I transitioned to the patient experience. And I have personal experiences where they're not good. Traditionally, in the last, a decade ago, it's no secret, home health and hospice post-acute really lagged behind in technology. The frustration here, Jim, I think many times, is that the technology is there, but we as a group are typically slow to change. My own personal example was my mom. She was on hospice in a facility and had a fall, and it was a fall with injury. She, the traditional, this was only 2 years ago, and they paged the hospice on-call nurse, and the hospice on-call nurse happened to be in a movie theater at the time and didn't hear the page. Well, she ended up in the hospital. Not a good experience for the hospice organization, not a good experience for my mother, and not a good experience for me. That all could have been alleviated, and that could been prevented had they leveraged the technology that's there today. So I concur with Laurie, I concur with Kathleen, leveraging technology where you can to enhance that experience and really prevent those failures that we have because we don't embrace the technology that's available. Again, is really frustrating to me, and so that's partly why I'm on a mission that I am. That's why I do what I do, so that we can certainly alleviate those bad experiences in the future. I believe that it's starting to be embraced in a big way now. I think that will increase in velocity. And I think that what we're learning in the last 3 to 5 years is just going to enhance what we do in the next 3 to 5 years as far as how we can leverage technology and how we can improve that patient experience.
Thanks, Dean, and we appreciate your sharing your personal story as well. That really lends a lot of weight to the discussion, so thank you. Turning to the ways that care can be personalized through technology, could you discuss a case where technology not only streamlined operations, but significantly enhanced the capacity for delivering compassionate, personalized care to patients? Laurie, would you start with this one?
Yeah, absolutely. So when I talk about missions as well, why we do what we do, I'm in the world of triage. And so one of the So if we go back 20 years, I started as the on-call nurse. That was my first jump into hospice. So I've been the boots on the ground. I'm taking those phone calls and wishing there was some different pieces of technology I had 20 years ago that I could, that are in the market today. So understanding why your patients and caregivers are calling can really take you from always reacting and having reactive patient care versus proactive patient care. So if I can understand why they're calling every day at 5 p.m. or why my trending every day at 8 p.m. I'm getting the same types of calls, I can now switch my care to be focused, to be proactive versus reactive. If I can focus on proactive, when those crisis calls come in, because they will, we anticipate there will be reactive care, right? But when those calls come in, I am focused and able to care in a way that that crisis is really a better experience for the patient, because I'm not so focused on some of these other items that could have been handled during the day. So when we talk about utilizing technology, I am an analytics fan. And if you can use data to take away the emotion of a moment or a decision, you make better business decisions. So utilizing analytics and data to support creating your protocols and your processes and your standard of care can really enhance the personalized care that you're able to give because you have data to back it up. So for me, it's understanding why patients and caregivers are calling. If we have, 25% of our calls are medication refills after hours, I have a problem. It's more expensive because I'm paying all those after hours fees, but my patients are in a crisis because somebody didn't do their job during the day. So if I can understand that, I can flip that, right? And say, hey, here's a standard, gold standard process that we are going to have for medication refills that allows me to be proactive in my approach, that when my patients go into a pain crisis, they have the medications they need. So utilizing analytics, data to support visibility into your program will allow you to create better standard processes that are a best practice for you in your business, as well as business decisions. Take my emotion out. It's 2 a.m. when I'm reacting to whatever happened. That's a bad decision compared to, at 10 a.m. with some data to back it up. So, you can really personalize your care when you understand more about your patients, caregivers, and why they are trying to connect with you. So data, analytics and data all day long, and create visibility through any technology reporting platforms that you can, so you can understand your patients better and create better processes.
Excellent, thank you. And Kathleen, how have you seen technology enhance personalized care delivery?
I go back to a story of a woman in her 40s who was diagnosed with cancer and rapidly going downhill. We did not know a whole lot about the family dynamics at all in admitting her from the hospital. And the admission went very quickly. When we brought her out to her house, there was no one there, but we were told that family would be involved in caretaking. It was because of the text mechanism and the re-engagement and communication that we discovered that that family was in fact a 12-year-old child. So I think that it's what I've said before, that you never see the whole picture in one sitting, and particularly with the heavy regulatory weights and documentation right now required of clinicians, it becomes very difficult to get the whole picture unless there is persistent communication. And that very quick, persistent communication allowed us to nurture a situation that involved a child where we could bring more resources in, and we're able to be there for that child all the way into bereavement.
Thank you. Dean, what would you like to add?
Jim, another personal story, but this is not my story. This is actually the story of our founder, Kevin Childs. Kevin is a cancer survivor. At the time, he was just wrapping up chemotherapy, and he had a home health visit. The nurse was at his home, ready to take that port out, right? And what happened, and his background is similar to mine in many ways, is that he wanted to know what that experience was like. He wanted to make sure that it was a good experience. And when the nurse was ready to remove that port, her phone rang, right? Her cell phone rang. And he paused and he thought to himself, wow, what's going to happen here, right? Is she going to ignore that? But she didn't. She actually removed her gloves, answered the phone, asked him to hold on for just a moment, and answered the phone. And he thought about that, and he thought, that's probably not what she wanted to do. It's probably not that nurse patient intimate interaction that she wanted to have. And yet she didn't know who was on the other call, on the other end of that phone call. She didn't know if that was an emergency. So she had to answer that, right? She felt obligated to answer that. Well, one of the things that is provided today is the ability to put the nurse, the clinician, in a state that she or he is not available. I'm not available to take a call right now. That call will be routed to somebody that can take an emergency call. But right now, I'm going to forget everything else in the world, and I'm going to focus on my patient. And I'm going to have that emotional, intimate interaction with the patient. And I think from a technology perspective, and an example of being able to provide that face-to-face, intimate interaction, leveraging technology, I think is a beautiful example.
Excellent. Thank you, Dean. From your experiences, what key strategies or technological advancements have proven most effective in improving patient outcomes and experiences while also ensuring the well-being of the care team? Kathleen, perhaps you could start with this.
I think when I think about the care team right now, I think about how many years we've spent with opportunities to appreciate and help the care team feel valued. And I think that's been very necessary during the last 4 or 5 years. But Lori said something earlier that was really important, which is the care team feels most valued when they have purpose. It's wonderful to be able to reward them with good pay or a bonus structure or tickets to a hockey game or whatever you might name. But it's never as valuable as them finding true purpose in their day-to-day. And I feel like initially, because of the problems of the EMRs and heavy documentation, regulatory, a care team in the field doesn't necessarily see technology as leveraging quality or betterment in care. Many nurses will just say, I came in to this field, especially hospice and palliative, because many of them leave the high volume, fast pace of the hospital world to say just this. I came into hospice and palliative to have time with my patient, and I find myself documenting it 10 o'clock at night. So the question becomes, how can we take that some time off of their hands, give them the time back they need to feel purposeful and like they're in this for the balance that they wanted and the meaning that they wish to find. And it's even more challenging to be able to show them how much you want to be their partner when you're behind a desk, because oftentimes there's not a seen interconnection between the indirect staff and the staff. But CareXM actually provides that, because There's lots of complaints and concerns that come through hospice and palliative families. Like I said earlier, they're sometimes in a state of psychosis. They're definitely in a state of high emotion. And the ability for us to be the one to receive that concern, complaint, question, and feedback, sift through that with the family, give them a call and say, we saw that you're only getting a 5 on a grade of 1 to 10, best care. What's going on? Well, my supplies isn't always here on time. And last time I forgot to tell my nurse that I really wanted some time away, and I don't know if I'm going to get that respite time. And the social worker didn't call me as I thought they would. Whatever has happened that has made them feel like it wasn't enough care, it wasn't enough help. And we're able to take care of that before the nurse even goes back to visit the patient, so that when they go in, they can give the care they need to give. They can go over that care plan, set the goals, and be with that patient. And I think that really does give them back the time they need. I was an ethicist in a hospital system for many years. That is my background. And really researched and wrote on what are the true ethical dilemmas in healthcare. Some of those named were having to do with power of attorney and advanced directives and futility of care. But at the end of the day, when you went through each case, and each case being very unique, very different, there was one common thread, and that was some lacking communication. It wasn't consistent, it wasn't collaboratory, and it caused a problem. So the ability to put this communication back in by doing more of it, again, humanizes the experience, takes some of the burden off the field team, allows us to all work together, and for the good of the patient, making the last chapter or the difficult chapter of their life much more meaningful. And we can focus on closure, and we can focus on forgiveness, and we can focus on bucket list trips. We don't have to focus on what wasn't done or what was left unspoken.
Excellent. Thank you so much. We're nearing the end of our time, but I'd like to give our other panelists a chance to answer that question as well. Dean, how would you answer that based on your experience?
Jim, one of the most significant advancements I've seen recently to impact both the clinicians and the patients is the ability to intelligently route communications to the right people at the right time. Historically, clinicians, let's just take a triage nurse, for example, they've got multiple calls coming in at the same time, right? Maybe it's a full moon. I've heard that many times. We're going to expect more calls on a full moon. Well, they don't have to juggle those anymore. They don't have to worry about what's going on in addition to the patient that they're talking to at that particular time, because they know that someone has their back. Someone's backing them up to support them. A clinician is backing them up, and they're going to treat that patient exactly the way they would want them to be treated. And so they don't have to worry about juggling all the demands of all the different patients at a particular time anymore. And from the patient's perspective, they don't have to worry about being put on hold. They don't have to worry about being called back. They don't have to worry about that. They can get the response that they need immediately and not have to worry about, any delays. That's been a significant improvement in the patient experience. It's been a significant reduction of that burden and stress and burnout from the clinician, just knowing that there's that support. In addition, knowing that, and this is to piggyback off of Kathleen as well, but knowing that management is taking the steps to help them do what they do best, right? And help alleviate some of that stress is a big win for the clinicians today.
Excellent. Thank you, Dean. And Lori, would you bring us home?
Yeah, I'm going to sound like a broken record a little bit and just say, communication Technology that enhances communication, connecting patients and caregivers with the right person at the right time is the success story. When you think of your own personal experiences, I'm thinking of mine as well, where my disappointment from a personal hospice experience really was, when my father-in-law passed away, I had to call an answering service and we didn't get a response to anything for 25 minutes. And I know the steps, the processes. I am a resource to my family to help them understand, but it did not help the situation that the person who needed to be connected, us to them, it took a delay. And so, enhancing patient communication is the success to utilizing technology and connecting with your patients. Like, that's where your success is going to come in, because it's really about getting the right people connected at the right time where your business will be successful. So utilizing technology is the only way to do that effectively today in this day and age. So finding ways to really, or putting into your business plan, your strategy to find ways to connect patients and caregivers quickly to those who can help them the best has to be one of your number one goals. Because if you can do that, you actually will have that domino effect of the staff burden will be decreased. If I'm doing only my job, I'm going to feel better about my job, right? I'm not going to feel so burnt out than if I'm doing multiple people's jobs or there's layers to get things done. So finding ways to engage with your patients that will create an environment with enhanced communication, allow you to be more empathetic and supportive in your care of your patient is the pathway to a holistic approach to care. So technology is the only way for us to do that in this day and age.
Terrific. And thank you so much. I'd like to thank all of our panelists for their insights today. We are just about at the hour. I regret we didn't get to, we weren't able to squeeze in our audience questions, but we can follow up on those. And I'd like to thank everyone who tuned in today. Please take care.
Thank you.
Thank you.